severe flu season is taking a toll on the United States. We're seeing an uptick in cases across the country, from California, where 2 adults have already died from the flu in San Francisco, to New Jersey, where a 2-year-old has died. There's estimated 19 million illnesses at this point, 250,000 hospitalizations, and 10,000 deaths this season. Joining me now is former CDC senior health scientist, Dr. Henrietta Ross. She has a PhD in epidemiology and has served as a public health researcher and analyst for nearly a decade. Welcome, Dr. Ross.
Thank you.
This flu season has been quite severe. Is there any reason why, Dr. Ross, why we're seeing that we have this swing in cases this early within this the flu season? Is it because of the strain? What is leading to this being the case?
So it's because of the strand. So we have, it's a H3N2 strand, influenza virus strand. And this strand is coming to dominance. It's called subclade K. So previously, it hasn't been the dominant strand. And so for the influenza vaccine, we use what we've seen previously. And because of the mutations, our body just does not recognize the immunity to be able to fight it off as it would previous seasons.
And who is at the highest risk of complications if they were to catch this bug?
So those with chronic illnesses like heart disease, diabetes, those who are older, our older individuals like 65 years and older, and even our younger kids, those who are 5 and under, most especially those who are 2 years and younger. Also those who are pregnant women, and those are the ones that are more likely to experience severe illness, as well as those who are immunocompromised, those who are suffering from like cancer or HIV, where their immune system is lower. Those are the ones who are experiencing more severe illness with this particular strand of the flu.
Right. And how is this flu season interacting with COVID-19? We just got through, I don't know if we got through the pandemic or the pandemic is actually still present, but how is it interacting with COVID-19 and RSV in terms of co-infections and hospital burdens that we're seeing across this country?
Right. So the thing to remember is that we're in the respiratory virus season. So it's not only just the flu. We have COVID-19 as well, and then we have RSV as well. So there are cases that are presented with co-infection where people have COVID as well as they have the flu. But it's less than about 5% of those who are presenting with both. They call it the double whammy when you have two of the three. But in those over 200,000 people who have been hospitalized, only about 5% are presented with co-infection.
And I know current day, we have this administration and the Make America Healthy Again activists who are saying you should not get the vaccine, right? And it's been this huge debate. But what are the current recommendations for the flu vaccine? Like, who should get it? And when is the best time to get vaccinated?
Okay, we all should get it. 6 months old up. Everyone should get the virus. Ideally, should get the vaccination. Ideally, you would want to get the vaccination September, October at the onset, at the start of our respiratory virus season. But if you have not gotten it, you want to get it as soon as possible because it takes about 10 days to about 2 weeks for your body to build up an immunoresponse to the virus.
Mm-hmm. And it's one of those things. You said 6 months. I have 7-month-old twins now, and for the viewing audience, I did get their vaccinations at 6 months. They have 2 doses that they have to get, one at 6 months, and then come in 4 weeks later to get the second dose.
Yes.
So I'm not a hypocrite. I want to protect my children. So, what are the stages of symptoms that should prompt someone, if they do get the infection, to stay at home or testing and seeking medical care?
So if you get a fever, so the symptoms for the flu are high fever, body aches, the fatigue to where you feel like you've been ran over by a truck, chills, cough. If you are experiencing that, I would suggest that you stay at home. You can actually test for it. You can test with, much like a COVID test, they have flu tests that you can purchase over the counter, and you can test for those. Asking that you please stay at home because, of course, it's highly contagious. And so you want to keep everyone around you safe and flu free. But if you are experiencing severe symptoms where you cannot breathe, shortness of breath, asking that you please go to the hospital. Severe pain in the chest or stomach, please go to the hospital.
And what can we do to protect ourselves? Is there anything we can do to avoid getting infected by this? Very
sure. We have to take it back old school. We have to wash our hands. Wash your hands. Wash your hands for at least 20 seconds, getting in between the fingers, underneath the nails. If you are feeling sick, please stay at home. And for those who are immunocompromised, for those who have chronic illnesses, wear a mask if you're going out. If you're going out amongst a crowd of people, then wear a mask to prevent actually contracting the flu virus.
And if you're one of those high-risk patients, or even if you find yourself having a severe case of the flu, are there any antivirals that can be taken that they can help to reduce the symptoms and the duration of the illness itself?
Absolutely. You can take Tamiflu. So Tamiflu shortens the illness by 1 to 2 days. And it also helps with the symptoms as well. And it helps with the viral shedding because it's during the viral shedding period that you're most contagious and that you pass it on to others. So by all means, yes, go to your healthcare provider and get that Tamiflu.
Right. It's one of those things I think people don't go and seek help once they get the infection. If you're within that first day or two, that first 48 hours, getting the Tamiflu in your system, or Xofluza is also a medication that you can take. The Tamiflu is 2 pills for 5 days. Xofluza is 1 pill, right? Yes. Getting those medications as early on in your disease process as possible is key, because that can help to stop the replication of the virus and keep your symptoms at bay.
Absolutely.
Thank you, Dr. Ross, for coming to speak with us on this very heavy, very current topic of the flu. Mm-hmm. And, we appreciate your expertise, and keep up the fight, because we need people like you in to combat this vaccine, anti-vaccine movement that we have going on current day.
Thank you, Dr.
Thank you.